Do you know what cystic fibrosis is?
No, I do not.
I have no idea what that is.
I know it's a disorder, and I know that it's pretty serious.
No.
I'm late for class.
No, wait, come back! Do you know what cystic fibrosis is? Hi, so I heard you guys don't know what cystic fibrosis is. Don't worry, I'll teach you all about it. As you may know, cystic fibrosis, or CF, is a genetic disorder. Cystic means fluid-filled sacs, and fibrosis means excess connective tissue. Many people may think cystic fibrosis only affects the lungs, but it also affects the pancreas too. CF is an autosomal recessive disorder, which involves the CFTR gene, and this gene creates the CFTR protein. C means cystic, F means fibrosis, T means transmembrane conductance, and R means regulator. As cystic fibrosis is a recessive disorder, it requires mutated CFTR genes from two carriers, mom and dad. But when they have their child, there is a 25% chance the child inherits both CFTR genes. Normal CFTR protein helps pump chloride ions into various secretions. The chloride ions help attract water into the secretions to thin it out. For a CF patient, the mutated CFTR protein is misfolded. This means that the chloride ions can no longer pass through the membrane. This makes the secretions thicker. In newborns, the thick secretions can affect their first stool or meconium, which can cause their stool to be stuck in their intestines and lead to a surgical emergency. In early childhood, the thick secretions could block the pancreatic duct, therefore blocking digestive enzymes from entering the small intestine. The lack of digestive enzymes results in no protein or fat being absorbed. As a result, individuals are undernourished and struggle to gain weight. The backed up enzymes could also cause pancreatic inflammation. Later in childhood, lung problems start. Normally, cilia clear the lungs by using mucus to move bacteria and dust towards the pharynx. But with CF, the mucus thickens, making it difficult to expel, and this may lead to an increase in bacterial colonization. Some common symptoms include persistent cough, at times with phlegm, frequent lung infections, wheezing and shortness of breath, struggle for waking despite good appetite, and difficulty in bowel movement. There are a lot of ways to diagnose cystic fibrosis, and they are: newborn screening is done in the first few days of the baby's life. The healthcare provider takes a few drops of blood from the baby's heel and sends it to the lab. Genetic testing is conducted by the baby's parents to rule out if they both carry the CFTR gene. Lastly, sweat chloride testing measures the amount of chloride in the patient's sweat. For CF patients, they would have a higher concentration of chloride ions due to the defective CFTR protein. Cystic fibrosis has no cure, but there are interventions that you can do as a nurse. The first thing that you can do is to remove and to prevent any infections that occur in the lungs. The second thing that you can do is to prevent and remove any mucus buildup in the lungs as well. The third thing that you can do is to remove any intestinal blockages. And the fourth thing that you can do is to provide adequate nutrition. There are many different medications that you can use for cystic fibrosis. The first ones are inhaled medications called bronchodilators. They help relax the muscles in the bronchial tubes. Now over here I have some more medications. The first one I have is anti-inflammation. This helps lessen the swelling in the airways. The second medication that I have is mucus thinning. As the name suggests, it helps thin out the mucus stuck in the lungs. This helps the patient to cough up the mucus and improve lung function. The third medication that I have is oral pancreatic enzymes. This helps you absorb your nutrients better in your digestive system. The last medication that I have is antibiotics. It helps treat and prevent infections in your lungs. Thank you for listening, and I hope you learned some new medications for your patients.